Hi, we're here at Peaceful Spirit Massage and Wellness Centers with Alice Adams, licensed acupuncturist. Hello.
Hi.
So, Alice, tell us a little bit about your background.
Well, I started out in my working life as a registered nurse, and I've been a registered nurse now for 31 years. And I decided to go back to school, graduate school, and I have a master's degree in Five Element Acupuncture, and I've been practicing that for 21 years.
Wow, congratulations.
Thanks.
So, I know there's a lot of different styles of acupuncture. There's Five Element, there's TCM, which is traditional Chinese medicine, and some others. Can you tell us what's the difference about Five Element?
Well, Five Element Acupuncture is a very ancient form of acupuncture. It came into being about 200 BC in China during the Han Dynasty. And at that time in history, people were very much in tune with the natural world around them. And this acupuncture really comes out of what we call a Taoist perspective. So we're really looking at the person in terms of diagnosis, first and foremost from what we call the body, mind, spirit perspective. So people often come to acupuncture practice with something that they feel like is on the body level or the physical level in terms of what they're seeking treatment for. And while that may be true, they may have a symptom that's related to pain or something that has to do with a problem with their digestion or maybe trouble sleeping or anything that they might define as being on the physical level. But in the diagnostic process, we're also looking at what we call the mind-emotional level and what we call in Chinese medicine the spirit level. And all those things are equally important in treating the person in a holistic way. The other major difference between what's called traditional Chinese medicine or TCM and Five Element Acupuncture is that we're really trying to define what we call the person's CF, or it's sometimes called their constitutional factor or causative factor. And that's really the way that the person individually interfaces with their world. If you wanted to use the comparison of, say, a bear versus a fish, for example, obviously a bear would interact with their environment in a very different way than a fish would, and if a bear were trying to act like a fish or vice versa, they would certainly come up against a lot of struggles, a lot of difficulty. So rather than trying to support the bear to act like a fish, we're really seeking to support the bear in being the bear, in interacting comfortably with his environment as a bear. And when you're able to support a person in that essential way, in that essence of who they are, then all the physical symptoms can be addressed in that way by kind of supporting the person in a way that allows them to move out into their world with grace and ease as opposed to struggle and stress.
Excellent. Well, that was a great definition for us. Thank you so much.